All right, for all my fellow medical microbiologists out there, the story of smallpox. It's really the ultimate case study, isn't it? It's our profession's absolute greatest triumph, but it's also a story that left behind this fascinating and, frankly, pretty unsettling legacy. Now, we put this explainer together using a Gemini deep search, and you can find all the sources we used in the linked Notebook LM document. Let's get right into it.
So here's the plan. We'll kick things off by looking back at that monumental win, the eradication. Then we'll profile the enemy itself, the Variola virus. From there, we'll dive into the tricky situation this victory created, a modern therapeutic void. We'll see how the Netherlands is tackling that uncertainty, then zoom out to look at the immunity gaps this left across the globe, and finally wrap up with the real legacy of this whole thing. Okay, first things first, let's just take a moment to really appreciate the sheer scale of what was accomplished here. This was a true landmark moment in the history of medicine.
I know, we've all heard this line before, but just let it sink in. The only human disease we have ever wiped off the face of the planet. This wasn't just a win, it was a total, complete victory for global cooperation. But, as we're about to see, that absolute success created a brand new set of problems for us to deal with today.
So let's get to know the adversary we actually defeated. What was it about the Variola virus that made it such a uniquely dangerous pathogen for humans?
This table is really where it gets interesting, especially when you compare Variola virus to its relatives. Taxonomically, we're in the Poxviridae family, genus orthopoxvirus. The virion itself is this big, complex, brick-shaped particle. But look at that first column for Variola virus. See that human-only host range? That was the key. That was its Achilles heel. No animal reservoir meant we could actually break the chain of transmission for good. But at the same time, that high clinical severity and incredibly efficient human-to-human spread, that's what made it an absolute terror. A mortality rate of up to 30%. Just think about that number. That alone explains the global panic, the urgency. This wasn't just another disease, it was a plague. And beating it is without a doubt one of our greatest achievements. But that incredible success leads us straight into the central paradox of this whole story, this profound and kind of unnerving therapeutic gap that we're all living with right now. This quote right here, this is the whole problem in a nutshell. We beat the disease before our modern antiviral toolkit even existed. We have zero clinical trial data for treating a live smallpox case with modern drugs because, thankfully, there haven't been any cases. This is a massive challenge, since our entire system of drug development relies on clinical trials that are now totally impossible to run.
And that's the million-dollar question for every public health agency on the planet. If the unthinkable happened, if smallpox somehow re-emerged, where would you even start? Well, the only answer is to have a plan before you need one. So how do you plan for something like that? Let's take a look at the Dutch approach, where the RIVM has decided to face this therapeutic uncertainty head-on. Right, so instead of just waiting around for a crisis to hit, the Dutch strategy is all about creating a clear, evidence-based roadmap ahead of time. The whole point is to get rid of any clinical ambiguity before it can cause deadly delays in a real emergency.
And here's what that plan looks like. It's proactive. It's not a what-if. It exists right now. The guidelines are hierarchical, so there's a clear first, second, and third-line treatment option. For instance, the Dutch guidelines currently point to tecovirimat as the first-line agent, with specific dosages and durations laid out. Then you've got cidofovir or brincidofovir as alternatives, but each comes with its own safety profile that a clinician would need to manage. It's unambiguous, it's practical, and it's designed to be something a doctor can use in the middle of a crisis without having to guess.
But the story of smallpox doesn't just end there. It's not just about the absence of one disease. It's about what that absence created on a global scale. And here is the huge, unintended consequence. When we stopped smallpox, we also stopped the routine vaccinations that, as a side effect, gave us broad cross-protective immunity against its viral cousins. So now, for the first time in centuries, we have a global population that is immunologically naive to the entire orthopoxvirus genus.
And we didn't have to wait very long to see what that meant in practice. The 2022 global Mpox outbreak was basically a real-world stress test. It wasn't smallpox, but it exploited the exact same immunity gap. For the Netherlands, and for the whole world, it was a live fire drill. It tested everything, from our diagnostic capacity with RT-PCR assays to our contact tracing, our infection prevention and control protocols, and even the logistics of getting assets out of the strategic national stockpile. This really lays it out perfectly. The historical threat was one thing, smallpox. We aimed all our firepower at it, and we won. But in doing so, we created the perfect conditions for the modern threat, a world where other, once rare, orthopoxviruses can suddenly emerge and find a completely vulnerable global population waiting for them.
So what's the bottom line here? What is the ultimate lesson we're supposed to take away from the entire story of smallpox?
The victory over smallpox was never an endpoint. It was really just the beginning of a brand new chapter. Its true legacy isn't some trophy we put on a shelf. It's a standing order for constant, perpetual vigilance. We have to see the orthopoxviruses not as a series of individual threats, but as an interconnected family, and our preparedness has to reflect that new reality.
And that leaves us with this final thought. It's a tricky one. In eradicating one massive monster, did we accidentally open the door for lots of smaller ones? The answer is complicated, but it forces us to admit that in public health, every solution creates an entirely new set of challenges.
And that's where we'll leave it for today. This conversation is far from over. What are your thoughts on our current strategies for these emerging threats? Let us know down in the comments. And for more deep dives into the critical topics in medical microbiology, make sure you subscribe. Thanks for watching.